You're watching CTOM TV. Knowledge is power.
So one of the big things with sarcomas that is different from other cancers is sarcomas are largely a disease of something called epigenetics. And epigenetics is a relatively new field. I mean, we do, if you go to any university, you'll see whole departments focused just on epigenetics. They get really in depth to the specifics of it. It's a very complicated set of processes, and it works mostly on what we call a global scale. So whereas targeted therapies will work on specific genes, epigenetic targeted therapies will work on a whole bunch of genes at the same time. So basically, what is epigenetics? So obviously, we have specific types of tissues in our body. We have many different cell types, but we have, basically four main tissue types: epithelial, connective, muscle, nervous. I believe blood is connective, bone is connective. So how do we get all of these different tissues and all of these different types of cells in our body? The genome for all of our tissues is exactly the same. So every cell in our body theoretically has the exact same genes, the exact same genome. Everything's roughly the same. However, in some tissues, certain genes are turned off, and other tissues, certain genes are turned on. And that is how we get different tissues. So we could potentially carry the genes for bird wings in our body, in our genome. But if they're never turned on, then we'll never grow bird wings. And I'm talking theoretically here. There's many different things that our genomes, could you go back, please? There's many different genes that we have that we don't typically know if we use them or when we use them, or maybe they're just used at certain points in our lives, but they're turned off for a long time or they're turned on. So the way our body creates different tissues is by differentially turning on different genes in the same genome. And this is what we refer to as epigenetics. So epigenetics is basically the turning on and off of specific genes in different tissues. So it's an important process, and we haven't really delved into it a lot in cancer. We're starting to see just how certain cancers, such as sarcomas, are really diseases of the epigenetics, the control regions of the gene expression. So while sarcomas do have genetic mutations that can be detected in, through genetic sequencing, a big part of the change in sarcomas from normal tissues is different expression of genes. And this is where the RNA sequencing is so much more important. So RNA sequencing has really changed how we treat sarcomas now. We have an amazing tool that allows us to look at all of the different differentially expressed genes in sarcomas, and that can lead us to all kinds of different targeted therapy treatments. So really, RNA sequencing is the key to coming up with treatment options for sarcomas. So additionally, we can get what's called fusion genes. And so that's where there's a genetic alteration where the on-off switch or the control region for a gene that is either turned on or off gets attached to a gene that has an opposite function. So for example, let's say you have a gene that protects you from cancers, a tumor suppressor, and it's turned on all the time, 24 hours a day, 7 days a week. Well, you can get a genetic mutation that causes the control region for a gene that's actually turned off, attached to this tumor suppressor, and this will then turn the tumor suppressor gene off. You can also get a growth and development gene that's supposed to be turned off after your embryonic development, but then the control region for a gene that's turned on all the time, such as a tumor suppressor, can get attached to that one. So this is what we call a fusion gene, where the control region for one gene gets attached to the actual gene that has a completely different function. And these are called fusion genes. So a lot of sarcomas are defined by fusion genes. In other words, there's key fusion genes that are used in diagnostics, and sometimes they can be used in treatments. So yes, as we mentioned earlier, this paradigm shift in treating sarcomas not only involves looking at the genetics and seeing if there's targetable mutations, but also looking at the RNA-seq and determining whether you have overexpressed genes that could be targeted with a certain drug.
Thank you for watching Cetome TV. Subscribe below and stay informed.